There we go. Hopefully you can hear me now. So, I probably won't make it as a professional streamer, let's be honest. But I'll just recap on what I was just saying. I haven't streamed much, but despite that, I've been consistently studying every day. As you can see from the 2026 stats here, it's pretty clean. And if we go to the whole collection, and then last year when I started on the 20th of December, managed to consistently study every single day, even if it's been only a few cards per day, averaging 62 reviews per day. Well, I'm not sure, I think possibly it's a little bit more than that. Yeah, there we go. 59 reviews per day and 2,463 cards reviewed in total, of which there's approximately 700 cards there. I'd like this number to be in the thousands by the time I get to April the 14th. And I'll show you just some little update on the Pokemon. So I started off with Charmander. I think it starts you at level 5. You can check down in the comments for the Jake Rom video, which really is a great intro, or you can check back to my first video, which kind of shows that intro process if you're looking to get started. By the way, I'm Dr. Chris Grieco. I didn't remember to say at the start. I'm a radiology registrar at Adam Brooks in Cambridge, UK. Anyway, I made it to level 16, and then there was this evolution glitch, and it just kept resetting me back to level 15, but wouldn't evolve into Charmeleon. So I just uninstalled Anki, uninstalled the Ankimon plugin, and restarted from scratch. Started with Charmander again, and have just been grinding every day. But I changed the settings slightly so that I would collect Pokemon as we go. So I'm now well in excess of 100 caught, which is quite cool. And if we go to the leaderboard, which is here, you can see I've slowly been progressing up the leaderboard. And the reason I decided to start collecting them as well is because I kind of did some napkin maths and figured I would get to level 36 a bit earlier than anticipated. So I've been collecting them as well, and that's been shooting me up the table. So I'm 147th as it stands at the moment in the trainer leaderboard. So without further ado, get studying, get through the cards for today, and hopefully, possibly, level up Charmeleon to Charizard. We've got about 4 levels to go, so I'm not sure how much time I've got today, but yeah, hopefully I'll be able to. I've got until at least kind of 1 o'clock today, so got a couple of hours to study. So yeah, let's go. First question: 58-year-old man was found to have an incidental lesion measuring 5 centimeters in the anterior mediastinum. The lesion shows heterogeneous, so I know this one already. Anterior mediastinum, heterogeneous with calcifications. It can be homogeneous. That's more of a lymphoma picture. This one is iso-intense to muscle, cystic components. So thymoma. Please work. I'm going to use Ember. We caught an electrode. Nice. Ember seems to be the most powerful move, even though it's like one that you get really early on with Charmander. 58-year-old is found to have an incidental lesion measuring 5 centimeters in the anterior mediastinum. The lesion shows heterogeneous enhancement on CT with punctate calcifications. This is the one we've just done. Seems to be glitching. Yeah, it's glitching. I'm going to restart Anki. Hopefully that Venomoth will still be there when we return. Okay, open Ankimon window. Put on top. Right. Okay, so this is an osteochondroma, and with HMO, hereditary multiple osteochondromatosis or osteochondromas. I think that's what this question was. HMO, yeah, hereditary multiple exostoses, also known as diaphyseal aclasis. It's quite important to come across these terms because in questions they'll often use old terminology just to try and throw you off. This is the eye of the tiger. This came up in a lecture yesterday. Haliburton spats, which is iron accumulation in the globus pallidus or globus pallidi. Yes, there we go. But he was a Nazi apparently, so they've started to call it pecan. Dark T2 dark globus pallidus, which makes sense in terms of iron deposition. So this black bit will be the iron, and then the eye of the tiger is high signal necrosis. Level 33. So we're only 3 levels off Charizard now. Can't believe we're that close already. What have we got here? This is a posterior mediastinal mass, I think. It's neuroblastoma. Yes, it's a bit of an Aunt Minnie. MIBG has superseded the use of 99. That's not necessarily true. It depends kind of where you are. I'm doing nuke med at the moment, and they use a lot of technetium. So, yeah, most common posterior mediastinal mass in less than 2 years old. The buzzword is encases. It encases the vessels rather than invades them. Okay. Ampharos. This must be a Gen 2 Pokemon because I'm not familiar with it, to be honest. This looks like sclerosing mesenteritis or something along those lines. Yeah, misty mesentery, hazy mesentery infiltration, mesenteric paniculitis. Interesting. Ember's such a powerful move for some reason. This, I think, is this talking about magic angle artifact, or is this talking about supraspinatus tear, full thickness? If it's full thickness, you get this leaking of contrast, so it's an MR arthrogram, rotated cuff tear. Left and mid-left, T1, T2, fat sat, partial thickness of the infraspinatus on the articular side, bursal sided fibres are intact. Okay, so we're not getting leaking into the bursa. So I give that a 1, so we can repeat that question. Caught a wild Ampharos. Gligar. Trying to think what this is. Oh, that looks lead pipey, doesn't it? That descending colon. So yeah, let's go for ulcerative colitis. Right, I remember the learning point here now. It was a traveller who had colitis, and salmonella was the... So there's regions of specific colitis depending on the organism. So left-sided colon, which is descending, is schistosomiasis, like this one, whereas more right-sided colon, suppose these two, is more salmonella or shigella. Diffuse CMV, cytomegalovirus E. coli. Rectosigmoid, so distal gonorrhea herpes, which kind of makes sense. I'm not going to say why. Oh, what we've got here, this is hyperdense melanoma. And it's ground glass surrounding the nodule. This is the halo. Can't show you here now, but this hyperemic kind of abnormal vessels around the consolidative lesion. Okay, Carmen meniscus sign is the malignant gastric cancer one, this one. I'm not really sure I understand why it's called that, but and then this is like Hampton hump, which I think is a benign gastric ulcer or duodenal ulcer. Hampton's line, benign gastric ulcer. Carmen meniscus, malignant gastric ulcer. Curvilinear lens shape, intraluminal form of crater. If you say so. Nasopharyngeal carcinoma, being in the fossa of Rosenmuller, maybe. Squamous cell. Nasopharyngeal carcinoma, yeah. Squamous cell. I'm going to repeat that one because I think there was a question on what is the most common type, and I got it wrong. We're leveling up. This is types of thyroglossal ductus. So type 2 is most common, but what it's showing on that picture of type 3 is the displaying of the carotid bifurcation, and that, I suppose it has, yeah, it's a differential for a glomus jugulare tumour, but this is benign and probably is not going to invade the vessels, which I think glomus or paraganglioma, whatever you want to call it. Bailey classification, second branchial cleft, so not thyroglossal duct, it's branchial cleft. So I'll repeat this one. Platysma sternocleidomastoid, between the sternocleidomastoid submandibular, lateral to the carotid sheath. Okay, what have we got here? And this is the partial thickness, rotator cuff tear, and the arthrogram depicted to demonstrate that there's no fluid going into the bursa. I think I need to have a swat up on that again. Not very good at shoulder stuff yet. Okay, what have we got here? This looks like an ablation cavity. Could be a bioloma, the mural nodule thing, but there's fluid in it. It's not the hemophilia, I think it's bioloma. Mural nodulin cyst is a late, yeah, it's a late complication of ablation, radiofrequency ablation in this case. Quarter haunter. Unfortunately, when you catch a new one, you don't get the XP attributed, which means slightly slower to progress to the next level, but I think it's fine. This is talking about fluoroscopic injection targets. That bottom one a shoulder? Yeah. Yeah, I think that was a question about externally rotating the shoulder to try and get in the joint, and then presumably for the femoral injection you just want to be away from the neurovascular bundle, so you can laterally. Let's see what it says. So hip internally rotate, superior head neck junction. Shoulder you externally rotate. Ooh, 92. This slide is about the similarities between two parotid cancers, so carcinoma mucinus and adenoid cystic carcinoma. They both have perineural spread. This is I think it's this one. I really don't know where the abnormality is here, parotid. I think that's it. But essentially they're both going to have perineural spread. This is much less common, and I suppose it's hyper intense. This is presumably this post contrast because mucosa. Adenoid cystic carcinoma, mucoepidermoid carcinoma. It's common malignant tumour. The tumour is composed of both mucoid and squamous epidermoid cells. Oh yeah, I was going to get some tunes on as well. Let's do it. Hopefully it won't be too loud, so I'll just play it nice and quiet. Alright. Next up, I want to try and smash through these cards. Yeah, nearly there for my cards. This shows bilateral cystic changes, upper lobe predominance. So there's a few different differentials for cystic. You've got lymphangiomyomatosis, which is only in women of childbearing age. You've got LIP, lymphoid interstitial pneumonitis, which, or pneumonia, is associated with Sjogren's, and more elderly females with autoimmune disorders. Then, yeah, I'm not really sure what this one is. This is Langerhans cell histiocytosis, which was the other one I mentioned. Predominate in the upper zone, sparing the costophrenic angles. Bronchoalveolar lavage. Two or more merging. Bizarre shaped. Okay, I guess that's a good example. And there's more. Maybe that's a good differentiator then. Scattered nodules. Let it seal. Let's go for that. So we'll get those repeat ones soon. For the time being, crack on with the other reviews. These are all quite good exam fodder, which I can't remember, to be honest, what half of them are. Endometrioma, dermoid, ovarian dysfunction, Meig syndrome. Meig syndrome is a weird one. It's like, I'm getting confused between Krickenberg tumours, which are gastric to ovary, and then Asherman, and then you've got fibrothecoma. Need to have a little look into this. MRI scan of 45-year-old woman. Ooh. Can't remember what Asherman syndrome is. I think it's ovarian dysfunction, because potentially you could embolize the ovarian artery. Asherman syndrome, infection with TB. Fibrous bands. Oh, that's the thing where you can have a fallopian tube, like, not angioplasty, but tuboplasty, I imagine, on HSG. In the world of interventional radiology. Meiggs syndrome. Triad of ovarian fibroma. Ascites and pleural effusions. So pleural effusion, ascites and fibroma. Right-sided more common. Neonate, born with history of prolonged labour. Routine cranial ultrasound. Small posterior fossa. Myelomeningocele. It's not type 1 because of the myelomeningocele. It's type 2. It's nice they haven't put type 3 there because I think probably that doesn't quite give you enough information to differentiate 2 and 3. Liquefaction. Gosh, that sounds bad. A 61-year-old woman presents with a gradual loss of visual acuity in the left eye. She has left-sided proptosis. On examination, CT head post-contrast reveals thickening of the optic nerve sheath complex, the tram track. So it's tram track versus fusiform. Key for differentiating between glioma. Glioma would be fusiform versus meningioma. So I'm going to go for meningioma. Yes. 64 man. Alcoholism, fever. Makes you think Klebsiella, which it says in the stem. Opposed to pneumococcal. Loba. Bulging fissure. And you can also get Klebsiella liver abscess, which apparently has quite a characteristic appearance. Yanma. You're reporting a CT scan of the neck in a patient with head and neck cancer. Enlarged jugulo-digastric. So jugulo, here, digastric, both digastric. There's probably a bit lateral, so it'll be level 2. Submental, submandibular, jugulo-digastric, deep cervical, of posterior triangle, and then prelaryngeal, pretracheal. 7 superior mediastinal. 1 hit, Yanma, 87 HP. Hard mass in the parotid. No, we'll switch questions from syncing. Squamous. This is the perineural. Oh, look at that EV. 50, woman, gradually increasing shortness of breath. Chest X-ray and high-res CT show subpleural reticulation. So that means reticulation next to the pleura in the lower zones. NSIP. Ground glass. Right? I think it's ground glass. UIP is honeycombing and air trapping, I think, so I'm not sure. I need to go over these again. There's 6 patterns of lung pneumonias. DIP, discriminative. That's like our build, but more. Oh, there's a good podcast from FRCR, Songs for FRCR 2A, on this topic. Like, I found that was probably probably the best podcast they've done. $65-man pigeons. Relatively spared. Costophrenic. Ooh, Ledian. Don't think I've seen this one before. 3-year-old MRI brain, Cerebellodonts, Foramen Magnum. Craniosynostosis. I've got to start my timer. Start now. Slugma. Hemangioma, because you can biopsy suspected hemangioma. Might bleed, but can still do it. Salter Harris epiphysis, which is the end growth plate, and the metaphysis, so it's a 4. One is through the growth plate, slipped, so a Sufi type. 5 is compression, so loss of the growth plate. 3 is lower growth plate and epiphysis, and 2, most common I think, through the metaphysis and growth plate. That's routine fodder. So it's the right kidney mass, it sounds like. So I'm looking for, 2-year-old, so I'm looking for a neuroblastoma description. C. Let's just have a read of these. So, adrenal hemorrhage, Wilms, mesoblastic nephroma, and rhabdoid. So, rhabdoid tumour, centrally located heterogeneous mass arising from the right kidney with crescent-shaped subcapsular fluid collection. Okay, mesoblastic nephroma, solid intrarenal mass of the right kidney. Mesoblastic nephroma, solid intrarenal mass of the right kidney, uniform enhancement. Mesoblastic nephroma, uniform. And less enhancing than normal. Parenchyma, areas of low attenuation. Okay. Wilms tumour, well defined heterogeneous, partially cystic, claw of right renal tissue, partially extending around it. It's kind of like eccentric, and you get this remaining claw. That's a buzzword for sure. Adrenal hemorrhage, well-defined round mass separate to the right kidney with peri-adrenal fat stranding and low attenuation centre. Why low attenuation centre? Maybe the actual gland, because the hemorrhage would be higher. Gosh, we're nearly up to level 34. 36, female tonic-clonic seizure. Remember this question now. Lateral displacement. So it's the fact that she's got like mass effect and it's involving more than 3 areas of the brain. Minimal mass effect, but it is mass effect. So it's gliomatosis cerebri, gliomatosis. Does it say who grade it is? Involve 2 or more lobes. Neonatal ultrasound shows kidneys which are enlarged bilaterally. Neonatal. Autosomal recessive. Marked reduction. Well, newborn, reduced air entry, breasts. I really struggle with these for some reason. So newborn doesn't say the age or the prematurity or anything. So we've got to presume that term. And I've done a VQ. So if you've got pulmonary hyperplasia, you're going to have less perfusion and less, but they'll be matched. Bosh. 30, female, pelvic pain, irregular periods, ultrasound, 4 centimeters, homogeneous, hypoechoic, low level internal echo. Oh, what is this? Is this a low level internal echoes? I want to say endometrium, but I'm not sure. If it said posterior acoustic shadowing. Let's do it. Yeah, endometrium. 50 man MRI right shoulder. I don't love shoulder MRI. Which pattern of imaging features compatible with partial thickness? Just increase signal. B. Wow, Gyarados. What a beast. This used to be one of the best in Pokemon Go. 10, boy, painful lump on the left side of his head. Eosinophilia. Oh, this made me think of fibrous dysplasia or something. Punched out. Yeah, eosinophilic granuloma. Langerhans histiocytosis, not fibrous dysplasia. Gyarados is not prone to, or not susceptible to fire moves. Let's try something different. Patient found unconscious with external signs of abdotrauma. Duodenal fluid and pelvic fluid. It's dense as blood. What type of blood? So I suppose fresh is the same as this, but this one's got iodine in it. Unless I'm misunderstanding that. So if you like put the Hanswood units on a vessel on an unenhanced scan, presumably you get that. And then unenhanced. Because of like the, I guess, fibrin. It's making it semi-solid if it's clotted. I don't know. Right-sided lower abdo pain. Small pedunculated oval-shaped mass. O minus. Adjacent to the proximal descending colon. This is epiploic appendigitis because they're fat lumps. Wrong place for appendix. And it's not diverticulitis. Isotope bone scan. So the fact that you've got something on bone scan means that it is a stress fracture, not just a shin splint. No, I'm wrong. Delayed bone scan. So the blood pool. Not that this would ever happen. Like, why would anyone have a? Maybe they would actually. Say if someone's coming with bone pain. And this is like physiological in this case because they're a runner, but it could be like bone mets or something if they've got a history of cancer. Okay, I'm just gonna move on from this one because I don't think it's a very likely to come up question. So Bogdalek is posterior and left. Morgagni is anterior and right. Pulmonary hyperplasia, I think that's true. So yeah, I'm going to go with D. Nice. Doesn't say whether it's a new one. I think that was a new one. 32. Man, African descent, urologist, neurosarcoid. Let's just read it. Facial weakness, blurring of vision. So that fits with like the leptomeningeal spread. Basal leptomeninges. So same pattern of enhancement as cancer, but it's a post-contrast finding only. Abnormal areas. Pituitary gland, optic, facial nerves. Low signal T1, high signal and flare, fluid attenuated inversion recovery. So fluid attenuated, not quite sure why that is. Maybe just edema. Anyway, it's neurosarcoid. We're going to get this Gyarados and get to level 34. 51, man, painless swelling of the left eye. Found to have left-sided proptosis. Low T1, high T2. The lacrimal gland. Oh, is this a lymphoma? Yeah, superior rectus lymphoma. Let's just read the others. Cavernous hemangioma, that's posterior eye and intra and extracornal graves. I'm thinking more thyroid women. Autoimmune. Capillary hemangioma. I'm not too sure about that one, but I think probably you get like flovoids. Mets. Also less likely. Yes, Charmeleon is now level 34. I kind of regretting putting the Charizard in the title now, but looks like we're on for it today, potentially, if I keep going. Okay, 15-year-old boy presents with a lump on the left side of his neck, which has grown recently. It lies anterior to the border of the sternocleidomastoid. Left side of his neck, anterior to sternocleidomastoid, so here. This is that Bailey classification I showed earlier. This is why it's so good, because you get like repeated, what's the term I'm looking for? Can't think. Anki's good though, because it gives you the chance to consolidate learning points, and especially if you make a card of your own when you get one wrong, like I have done with this. Now I've got an image in my brain when I hear about types, Bailey classification of second branchial cleft, cis. Very specific, isn't it? Very radiology. Okay, last one. And then we're on to new questions. 45, woman, right hip pain. Large lucent lesion with stippled calcification. Wide appearing. Destructive in transition. This is the chondroid matrix, isn't it? So I'm going to go for chondrosarcoma. I don't have a picture of this in my head yet, really, but okay, let's move on. Pupitar lives to fight another day. Not sure how to get it to reset my HP, XP, HP, HP. let it sink. I might go make a cup of tea. Two more levels to go till we got Charizard. I'm kind of amazed that already at that point in January they had no more of my cards, which are the 2 ACG deck. And then what I'll do is probably just focus on one of these for now. Or maybe we should do like, yeah, let's do 15-ish questions of a topic. And we'll keep the final one for final. So we'll do this one, this one, this one. I've got a mixed one here, so that can go with the final. And then we'll do Peds, I think is my next one. Peds, Peds, Peds. Then GI. GI, 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 then MSK, then GU, etc. Then cardiothoracic, final. Next. Headache, high fever, drowsy, I don't know why I keep getting this question. Just trying to think about the imaging features because I don't know this. I just know it because of the buzzword Asia, Japanese encephalitis. Is that really a new question? So that's just chance that I've had this one a lot before already. This is from the Lindsay book, Oxford. So, MRI. Increased T2, that just means edema. The fact that it's on flare. Hippocampal, temporal. Okay. You also get that with herpes simplex, I think. Thalamite, putamina. Increased T1. Hemorrhage. So that's probably pretty key, isn't it? Not sure whether you get hemorrhage with herpes simplex. Herpes simplex 1s with adults, herpes simplex 2s are with kids, I think. Japanese encephalitis. Involvement of basal ganglia. So that sentence is the differentiator on the travel history. So type 2 is herpes simplex is neonates, whereas type 1 is adults and kids. 70, worse than conductive hearing loss, not improved during following ear syringing. Which is the following? Where am I? CT, non-dependent soft tissue density within the left middle ear. Conductive hearing loss. With bone destruction. Non-dependent. Come on, think, man. Pass Flaccida. Oh, pass Dancer. Oh, what? Non-dependent made me think. What did I read that as? Like gravitationally. Well, I suppose that's all that's saying is it's not fluid. Okay, so I read too much into that. Where was this question from? Let's see. FRCR exam prep. Yeah, not a great question bank. Hate to break it to you. Cholesteatomas, acquired or congenital? Epidermoid cysts. Scutum. Let's see what this says. Yeah, I'm going to go make a cup of tea in a second, but before that, let's just make a card on cholesteatoma. 15. This is pretty high yield. Comes up a lot. Alright, let's go for one of these images. I think this one's quite nice. And to me, this is lower. Even though they're not equivalent images, at least on this representation. Flaccida is higher up than the tensor. Can we see the ossicles on the tensor? Soft tissue mass, black arrow. This bit. Tympanic membrane retracted. Level of the vestibulum. What's the vestibulum? Small bony fragments in the oval window niche. What here? Okay. This isn't the best just because it's labelled so heavily, but I think it serves the purpose of Gibbous deformity. That's a good buzzword. Anterior and posterior elements. This TB. It is TB. So epidermoid here is going to restrict diffusion, no? No. Smooth margin. Alright, time for a cuppa. Oh, actually, let's just get rid of this deck. Get rid. Yeah, fine. One more. 27. Head injury. CT brain. Subdural. Over an extradural. So subdural. Lenticular. Crosses sutures. Okay, nice. So we've done that deck. Next up, we're going to do more neuro because I'm still weak on neuro. But I'm going to give this one. No particular reason. Okay, tea time. And I will leave you with a copy of that way up of my little book, my little bookie book that is available for sale on Amazon. So yeah, I'll give you a little look, and then I'm actually going to go make a cup of tea. Very basic, but what am I doing? This is really tough to orientate on the. Peripheral arterial disease. Yeah, it's a good book. I'm proud of it. It was a project that started a long time ago and managed to bring it to fruition, which is good. Resilience and persistence. Yeah. Just the first edition. Second edition is going to be an expanded version, which we're already working on. Got a draft edition, draft version. And yeah. Raising global baseline education in interventional radiology and image-guided surgery. That is my tagline for life. All right, time for a cup of tea. Okay, I'm back. We're back for another little sesh. I've got some snacks because I'm pretty hungry. Next up, 38, male, parietal AVM. Cerebral atrophy. I'm really not sure on this one, but I'm going to go for B. Sounds like fluid, right? But why is it? Yeah, I wouldn't have thought. I guess blood essentially becomes fluid when it's chronic. So it's siderosis. It's a good question. That what book is that from? This doesn't say. Anyway, good question. And we're on to Meowth. Banana sign and lemon sign. Frontal lobe cortex. Bilateral indentation. We gotta load these up. It's banana. Lemon. That'll be the lemon sign. Neural. Middle. So this one. That's spina bifida. We've seen the lemon. That's good. Let's just Google this. Probably should make a card on that, but why does it not let me? There's a picture or something. No idea. Gosh, that doesn't sound good. Alright, next up, This food is distracting me. It's crashed. Good opportunity for me to eat some food then. Diglett! Level 32 Diglett. What a beast. Doesn't mention the orbits. So, I think it's a LaFort 1. Arachnoiditis, right? TB arachnoiditis. Wow. We had a Teddy Ursa earlier, now we've got an Ursa ring. Bimailer rash, learning difficulties. What's bimailer? Mailer rash is like the lupus one. This is tuberous sclerosis. Adenoma sebation. Bilateral renal AMLs. Nice. I'm definitely getting better. Feels like I haven't covered enough of the textbook, but I think questions are just more important. Done that one. We've done that one. Next, we're on to this one. But we'll just mop up these two. Shin splints! No risk of getting shin splints as a radiologist when you're sat on your arse all day. Sad times. Here we go. Pars flaccida. Flaccida is the top, which is much smaller but much more common and erodes the scutum. Tensor is at the bottom, which is much bigger, much less common, and erodes the malleus and incus. Tensor. faster down. Higher up, even though it's coronal, shows you it's higher up. Tensor, axial. Sinus tympani, pyramidal eminence, facial nerve recess. Tensor, eroding, ossicles. Cholesteatoma. Well, that's a good one. Okay, more head and neck. Neuro. Nine-year-old. Left occipital lobe. Is it NF1 or is it NF2? I think it's NF1. So P. I don't really have a good explanation of why I got that one right, but it's okay. It's okay to just get them right sometimes. No, I do. It just didn't sound like NF2, which is like the bilateral schwannomas. It sounded more in the nerve rather than the wrapping the Schwann cells. So it's a glioma or a, yeah. And an F1. 5-year-old boy, visual fixation, brain CT, optic nerve hypoplasia. Optic nerve hypoplasia. Third cerebrum. I think it's going to be D, right? I've actually seen a case of this yesterday. We had a good teaching session on, this might be wrong, but schizencephaly. Schizencephaly is the scarring one, right? Combination of septum septo-optic dysplasia. Never heard of it. Don't think anyway. Oh, here we go. These slides are goated. Demorsia syndrome. Will this come up in the exam? I doubt it, but if it does, I would have heard of it. Azygous ACA. Absent septum pellucidum. Flat roof ventricle. Small optic chiasm. Large ventricle. Schizencephaly, which I think is the scarring thing. SBA. Is that Lindsay? Not sure. Anyway, good learning point. We like those. Five-month-old blindness. Cardiac abnormalities and choanal atresia. I can't remember if there's like Vactal or Wagger or something. Congenital glaucoma. I don't think it's CD or E. Sounds like coloboma. But it could be congenital glaucoma. I didn't realise it was charge syndrome. I didn't realise it was bilateral. Encephalocele agenesis corpus callosum charge syndrome. Great questions. Great questions. Factor. Newborn girl found at birth to have hairy nevus overlying their spina bifida, right? Is this the same as what we just did? Or is that different? Phylum terminale. Let's go spina bifida. I don't know about Coulter, but tethered cord. That was my other one. Right, let's look that up. Phylum lipoma and Bavarianus phyllosis. Diastematomyia. That's what that is. Decompressive lung at birth, cones maturity. Is this tethered? That looks tethered. Let's just take that pick. I guess spina bifida or Coulter would just be like worse. Oh no, Not my to-do list. I don't know how to get rid of that. Might be under peds. That will do. Should probably add. I've got spine in there as well. Yeah. Choose. Then we'll go next. Then we'll go back to here and we'll go add. There we go, close. Skizzen carefully. Opting over. It just says includes them. Skizzen carefully. Stormy postnatal period. PPH. Postpartum hemorrhage. Nausea. So, not that one. No, low signal shot. Let's go for this slide. I think insular ribbon is something else completely. I'm not sure what though. I got wrong. Yeah, I should probably do one on insular ribbon. Let's do that. Don't be lazy. Tethered cord, obviously. Oh, come on. Alright, we've done the neuro ones for now. I said I'd do peds next. Oh, now it's been half an hour to do 15 questions. About 2 minutes a question, that's fine. Yeah, pars tensor is the lower that erodes the ossicles. So we move on. When we move on to peds, I'm going to go for another half an hour and then call it. Regardless of whether we've got Charizard or not, might be a good cliffhanger. So maybe I won't. Yeah, we'll see. We'll see how far we get. 10-year-old boy presents with a mass in the posterior triangle of the neck. Night sweat, significant weight loss. Hodgkin's lymphoma. Right axilla. Left cervical chain. Got disease on both sides. I'm going to go 3. And yeah, let's go 3B. 2B. Diaphragm. Fair enough. Not going to get too worried about staging stuff because they try not to examine on that too much. Bloody diarrhea for your girl. 4-year-old. Not 4-day-old. Pale, irritable, dry mucous membranes. I'm thinking henoxin line purpura. I'm thinking interception. Hyperechoic cortisone. It's nephrocalcinosis. HUS is like E. coli, so I don't think it's that. Also, don't think it's that. Oh, bloody diarrhea! You can get with E. coli. Yeah, it is. See. Boom. 4-year-old boy has recently found to have large abdominal mass that is displacing the kidney inferiorly and encasing the aorta. See. Or A, yeah. I mean, they're both the same point. Let's do that one again. Left multicystic dysplastic kidney is diagnosed on an antenatal ultrasound. Left kidney postnatal. Multicystic dysplastic kidney. Which of the following are most likely findings postnatally? 3 weeks. Sounds like B, but I'll just read the rest. Yeah, B. Just sounds right. Stage 2B. Did we catch? Yeah. I don't know how it's streaming. If my internet is so bad it won't even sync. Anki. So apologies if the internet keeps cutting out. I literally just did that question in another deck. To be. Heterogeneous with low reflectivity. Whatever it is, it sounds pretty bad. My instinct is that it's rhabdomyosarcoma, but I've never really heard of that as a thing. Chalangea you kind of get with PSC. I guess you could get those things. I'm just going to go with rhabdo. Yeah. Just sounds bad. No rhyme or reason for these sometimes. Magneton, Magnemite. I think pulmonary mets are more suggestive of worms. Boom. That's a hard one though. Classification on CT. 85% remove plastic bone mets. Case vessels. One hit Magneton. Boom. Why does a fire type work well against an electric type? Ten child scalp lump. Oh, it's like the same as the other one, but Langerhans houses, yeah, X. Oh, what? Not like the other one. Lucent lesion, sclerotic margins. Scalp dermoid. These are all intracranial from what I can see. Skip to beads. This might be the one. Yeah, let's go for that one. It doesn't show bone erosion, but it does say it in the little description. So let's be quick. No other mount in the lungs. 10-year-old cough. Posterior intubation of mid-esophagus. Right subclavian. Aberrant right subclavian. Left aortic arch. Normal. D. All done. Done with them. Anterior thigh pain and limp. 6-year-old. So 6 is more Perthes than Sufi. Okay, so it's B or C. Come on, Nexus. Late. Okay, Dunsparce, and then maybe we'll level up. I'm not sure if I've caught a Dunsparce before though, so it might be a new one. 12-year-old African child with chest and back pain. 12-year-old African child with chest and back pain. Cardiomegaly. This is weird. Loss of contour of humeral heads. There's a sickle. Yeah, sickle. Sickle. Vertebra planar. High output anemia. Avascular necrosis of bones. Okay, we should do with this Dunsparce. 15, boy. Metastatic deposits in the lungs. Oh, gosh. Wilms or Ewings? Wilms. Let's do it on Ewings. Whoa, that was mad. That's crazy. Yes! Level 35! Okay. We've got 2 more in the peds section, and then I'll get rid of the repeats, and then I think I'll call it a day. 5-year-old girl, progressive puberty, Inhabin. What is this one? Inhabin. Let's go for the one that says juvenile in it. I heard this on the Songs for FRCR podcast. Yeah, granulosa Inhabin. Granulosa Inhabin. If I'd not said juvenile, I probably wouldn't have got that. One-year-old child, flu-like symptoms, bleeding per rectum. Pseudo-kidney sign. Pseudo-kidney interception. Alright, so we've done all the peds ones. Nice. So next up would be GI. So I might maybe come back and do some more later, but I'll just clear these last few. What was this again? This is some cool name. I can't remember. SOP or something. SOD, SOD, septo-optic dysplasia, Demorsia syndrome. Schizencephaly, Osgus ACA, small optic nerve, large ventricle, no septum pellucidum, flat roof ventricle. Demorsia syndrome. We'll give that one a. Yeah, I'll give that one a 2. Tethered cord. Thickened phylum terminale. Tethered cord. Alright, that about wraps it up for today's stream. Neuro and peds. Definitely improving. I just got to trust the process now. Keep this up until April without burning out. See how we get on. All right. Adios, amigos.